Powerful, huh? Okay, first things first, being a good doctor. Check with your doctor before you begin if you have any heart problems, chest pain, shortness of breath, injuries, etc. Choose activities you enjoy and vary them. Real important to cross-train. And set realistic goals, including frequency, intensity, and time. Otherwise known as FIT. Frequency, which is number of days of the week. Intensity, which is percentage of your maximum heart rate. And time, which is the time or session each day. Now, if you don't exercise now, you're a part of the 40% club, don't worry about this. Just build the habit. Today, when you leave here, build the habit. But if you want to get the most benefit for your cardiovascular system and your brain, which, by the way, it's one of the most important things you could do to prevent dementia and Alzheimer's, this is what you need to do. At least 30 minutes a day, most days of the week, so every 24 to 48 hours. If you want to figure out your optimal heart rate, there are calculators online, or you can use this and figure out what your target heart rate is for cardiovascular fitness. About 65 to 80% of your maximum. Some people who are really fit can go up to 85%. Then you're in the cardio zone. My favorite Randy Glassbergen t-shirt, which I'm getting now. What fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? Because that's the most common excuse. I'm too busy. If you're too busy to exercise and you're too busy to sleep well, then you're too busy.
I'd like to add one thing.
I'm getting interrupted by my husband.
I have a lot of people tell me that they don't have time to exercise. And I can totally relate to that because it doesn't seem like, when you're a busy person, you own a business and you're trying to make people happy and treat people, that you don't have time. But a lot of people will also come to me for time management. And I said, you can't manage time. Sorry. You can't manage time. This woman here is absolutely one of the busiest people that I know. Because after you leave her office, she's doing your charting, she's handling prescription refills, she's doing a lot of different things. And so oftentimes it's late into the evening. She has time to exercise. The reason is because while you can't manage time, you can manage your priorities and you can manage your energy. All right? We all have the same amount of time. All right? As Thoreau says, time is but a stream I go a-fishing in. All right? So where are you going to put your priority of health and exercise into that 24-hour thing that we call a day? And when are you going to have the most energy to be able to do that? Because if you say, I'll do it at the end of the day, and you get home at the end of the day, if you're like me, I'd rather have a glass of wine. So I do my exercise either in the morning or in the middle of the day when I still have the energy to do it. So get your priorities straight, because nothing else will matter if you don't have your health. And then manage your energy when it comes to working out or exercise, and do what you love.
Good advice. Okay, so we've gone through the first 3 steps to achieving hormone synergy. The 4th step is to sleep well and enough. And exercise is the first panacea in medicine. Sleep is the other. If you don't wake rested, you probably didn't sleep enough, unless there's something else going on. So you're not lazy. I get 9 hours of sleep a night, sometimes 10 when I've been running a lot or working a lot. That's what I need to recover. I'm not lazy. I just need that much to recover. If you are sleep deprived, it's actually been linked to a lot of health problems, like depression, decreased concentration, poor immunity, poor wound healing, high blood pressure, diabetes, weight gain, and reduced lifespan. 7 to 9 hours is the prescription, but again, if you don't wake rested, sleep more if you want more. Babies know this. Our last Hormone Synergy Jeopardy question. And I hope you all get this one right. We have some great prizes for this one, several. Name the 2 panaceas in medicine. Probably have to take that out of the video because, it is the Jeopardy theme music.
No.
Anybody need a card? Raise your hand. We'll bring it. You don't have to get out. Can we get cards, you guys? No cards? We need a bunch of note cards, Christine, so just bring them out.
Francis, where'd they go? Oh, here they are.
I got them.
Okay, so
I'll do it.
tell them what to
Mhm.
get.
Okay.
Just want 3 and the sweet.
Oh, we'll do a bunch. We have 6 or 7.
Yeah. Compounds also brought little pedometers for everybody here as a gift to us. You might want that.
Oh, yes. I will announce that when we talk about the weight loss program.
Want to just give away everything else?
No. Oh, we got 3 boxes of bars?
Another box of them with another women's essential and another essentials.
Okay.
Let's give this one away.
Okay. So grateful to all these companies that donated all these great prizes. Doesn't it make it more fun to learn when you think you're going to get a prize? Raises your dopamine, your sense of expectation. Okay, so the 2 panaceas in medicine are excellent. I think he gets a prize. That's it. He gets a prize. That was just too good. Okay, so chocolate and exercise are alternative answers. Not the ones I was looking for, but just as every bit accurate. Making me laugh, lowering my stress. You get a prize for that. Okay, so for this prize is a $50 gift certificate to Helium Comedy Club. So hopefully Susie Dieters likes to laugh. Yay, Susie, you will have fun with this. Maybe somebody want to. And the next prize is another $50 gift certificate to Helium Comedy Club. So hopefully this person likes to laugh. If you do not, I'll take it. Oh, she already won. I'm only going to let you win once because I think it's seem to be picking the same people. Montrace needs to laugh. She absolutely needs a Helium Comedy Club gift certificate. Can you pass that back to her? Thank you. Okay, and this is another wonderful prize. So this is a place that Daniel and I go to often to empty our stress bucket called the Barefoot Sage, where they do foot soaks and foot massages. We love them. And they were generous also to give us a gift certificate for $50 for services, and they gave you all a coupon, which we put in your packets if you want to go there too, which I thought was great. That's where we go when we're doing our detox and we don't drink alcohol. We go to Barefoot Sage a lot. It's really fun. Alice D. Hopefully Alice. Yay, Alice! All right. I'm so excited you're excited. Yay. Okay, next is a box of food bars, organics. These are actually my favorite ones because they're high in essential fatty acids. And Courtney Angeli gets Zymogen bars. Yay for Courtney. And the last prize is a pack of women's essentials. So this is an AM/PM packet. So take the AM and the AM and the PM and the PM. This is a multi-bone formula, brain support, fish oil, resveratrol, coenzyme Q10, etc.
Please take it with a meal.
Julia K. Yay, Julia. All right. Thank you. I think that's it. Yeah. Chocolate and sex. I'm going to put that in there next time. That's too good. Okay, step 5 in our 8 steps that we're going through is to avoid toxins and do a yearly detox. And step 6, if you remember, is to maintain an ideal body weight. Now, the idea of an ideal body weight can be challenging for some people because if we poll parents of children who are overweight, oftentimes they think their kids are normal weight. And because we see more and more overweight and obese individuals, we don't even know what a healthy weight is a lot of times. So you can look up your BMI. Now the BMI is a statistical calculation, so keep in mind that the BMI may say that you're overweight, but you're ideal because you have lots of muscle. Okay, so one of the things we do in our office is measure fat and muscle percentage, far more important to predict longevity and chronic diseases than just the BMI or body mass index. But this is your body mass index. So if you can see it on your paper, here's where you look for your height, and then here's where you look for your weight, and then you can find out if you're in the healthy weight zone, if you're overweight, or if you're clinically obese, so that you'll know. So we're going to talk about step 5, avoiding toxins and doing a yearly detox. And I'm going to introduce you to our program, the HormoneSynergy Detox program, which I've been doing for about 12 years with individuals. And I've been keeping data for about 7 years. I like to keep questionnaires before and after the program with the hope of someday publishing it and showing other doctors how they can help people go through an effective detox program. We also put it together as a home package because we couldn't do enough groups, and some people don't want to make the investment to come in and do it in person, so they want to do it at home. So that's available to you. I'm not trying to sell anything. If people have other questions about detox, I'm happy to give it to you. I just want you to know what's available because I know it works because I keep data on it. So this is a 5-week program, and these are some of the results that we get from the questionnaires. Improved energy, increased sense of well-being and mental clarity, elimination of allergies, digestive problems and pain, lowered stress, healthier diet, and improved exercise habits. And it's because this isn't just a detox, it's actually a transformational health program that we do. And here are some of the topics covered, and I'm sure you can all read, so I won't read through them. But basically, we talk about what detoxification is. We talk about food relationships and food addictions and how to overcome them. We talk about stress. We talk about exercise, and we get people to adopt better exercise habits through accountability, through a pedometer. And I understand that one of the sponsors for the seminar today, Creative Compounds, who we'll talk about later in terms of pharmacies, brought a gift for everyone. Is that right? Yes. A pedometer. So if you are not an exerciser, you now get to be starting this minute for free because of wonderful Barb and her pedometer. So Barb, do you want to pass them out, or you want to just have people pick them up if they want them? Yeah, have them pick them up if they want them, because some people probably won't want them. But your goal, if you're going to use a pedometer, and I used a pedometer for years before I got a body bug, because I like data, I like numbers, I like accountability. It works. It works for weight loss. So a lot of people say, oh, I get plenty of exercise. I work all day. I'm at work, I walk around all day. Really? Prove it. Put a pedometer on and look at how many steps you get. You might be surprised. Your goal is 10,000 a day. Now let's say you only do 2,000 a day. Then your goal is 3,000 a day, right? You don't want to set your goal so high that you end up not achieving it and giving up. So your goal is 10,000 steps a day, and wearing a pedometer helps you know whether or not you're achieving that goals. What you also receive as part of our, this is the in-person coaching program, is private sessions with Daniel for coaching for 5 weeks. We use a medical detox formula that's actually been clinically shown to enhance detoxification. Biofeedback stress thermometers, so that's how we teach stress reduction. And you get lots of DVDs and books, etc., and surprises. I can't tell you everything. When it comes to obesity, there are many factors that lead to obesity, okay? These are some of the factors that lead to obesity. Toxicity. We talked about endocrine disrupting chemicals that can disrupt your hormone system, can also disrupt how you're feeding, how you eat, and what you eat. Stress. We talked about hormone imbalance like low growth hormone, low testosterone, low thyroid, too much insulin or cortisol. Neurotransmitter imbalances, so chemicals in the brain that are responsible for mood and behavior. Some of them, if they're out of balance, can cause you to crave certain foods. Emotional trauma, of course. Some people eat for emotionally traumatic reasons. Repeated dieting or fasting. You learn my story of how repeated fasting actually led to a huge amount of weight gain for me. Lack of knowledge, not knowing what to do or where to start, or lack of accountability, stick-to-itiveness, and somebody to help you do that. The last thing on the list is genetics. This is going to depress you, but I want you to have the facts, okay? This is the average weight gain with aging. So this is body weight, and this is years. The average weight gain between the ages of 25 and 55 is 30 pounds. I know. That happens as you age. So oftentimes people come into me and they say, I'm gaining weight and I'm not doing anything different. I say, right. So 30 pounds in 30 years. It sounds overwhelming, yeah? Let's break it down, just strictly from a numbers perspective. You all know, or perhaps you don't, but I'm going to tell you, that 1 pound of fat is about 3,500 calories. This is 1 pound of fat, which you can pass around. And this, by the way, is 5 pounds of fat. Can you imagine what this does to your joints and your heart and your brain? So 3,500 calories in about 1 pound of fat. So 3,500 calories extra per year is going to give you a pound a year, yeah? Which over 30 years is 30 pounds. So let's break that down. That's 10 calories a day. Right? So you eat 10 calories extra a day, or you don't subtract 10 calories, and you will gain a pound a year. And just to give you a reality check, that's 2 M&Ms, 1 Lifesaver, or a half of a Hershey's Kiss. Every calorie counts. That's why you want to make them nutrient-dense calories, right? And why you want to do all the other things like exercise and keep your hormones balanced. Because if you eat handfuls of M&Ms, come on, somebody in this room eats handfuls of M&Ms, doesn't count them, isn't accountable for them, you will continue gaining weight. So these are some of the things that you can do if you feel like that woman on the scale who's about to rip her hair out. You can decrease your calories, become more mindful of everything you eat. It's not about deprivation, it's about choice. You can exercise. You can maintain your muscle mass through weight training and making sure the hormones that build muscle are optimal. You can use bioidentical hormone replacement, which can help. You can make sure your thyroid's optimal. Make sure your neurotransmitters are optimal in your brain so you don't crave unhealthy foods. Empty your stress bucket, because you now know that stress contributes to weight gain whether or not you do anything different. And there is some preliminary small studies that show that perhaps giving the mitochondria what they need to function more efficiently and create more mitochondria can help. Coenzyme Q10, fish oil, resveratrol, and D-ribose. This is a program that we do at our clinic called Ideal Weight Naturally. It's a 12-week program. The goal is ideal weight permanently. It's not about a fast and it's not about a diet. There's 2 phases to it. The first phase is a detox for a reason, because if you're toxic, you can't lose weight. And the second phase is an 8-week program. And you can all read, if you're interested in it, what we do for our Ideal Weight Naturally program. Just that the emphasis is on really getting you to achieve and maintain your ideal weight. It's not a fast. Okay, so we talked about step 1, which was decrease stress. Step 2, which is eat a healthy diet. Step 3, which is eliminate toxins and do a yearly detox. Maintain an ideal body weight. Sleep, and now supplements. This is a whole lecture in and of itself. I get the most questions about supplements. You'll notice it's step 7 for a reason. Sometimes people come into me with truckloads full of supplements. They're very proud of how many supplements they take. But they're not eating well, and they're not exercising, and they're not prioritizing their sleep, and they're not lowering their stress. So really, the emphasis needs to be in order. So supplements are meant to be a supplement. But first, we're going to take a little quick stretch break. So maybe 5 minutes, go to the bathroom, 10 maximum, get some tea. And when you come back, we're going to talk about that, and we're going to talk about bioidentical hormones. You are welcome to continue milling around. I just want to make sure I don't keep anyone who isn't staying for the wine tasting appetizer party afterwards. We're going to talk about supplements. And remember, there are going to be a lot of questions about supplements. And if you're already eating healthy and you're exercising and you're sleeping and you're managing your stress and you're doing a detox, you can ask me about supplements. Just kidding. Fish oil. Why do we need fish oil? Why is it good? Some people might remember getting fish oil when they were like in kindergarten or first grade. Anybody here old enough where they got that? Yeah. Now they give you dye and sugar. And then they give you Ritalin. Okay, so fish oil. Necessary for proper hormone and receptor interaction. So we talk a lot about the hormones. I don't talk a whole lot about the receptors and how the hormones work, but that's the other side of the equation, right? The key and the lock. So fish oil helps you maintain normal receptors. and the cell wall membrane. It lowers inflammation in the body. It lowers triglycerides. It may help lower LDL and raise HDL. It does more for triglycerides. It improves brain health and memory. Prevents depression. Slows telomere shortening. Aha! Very important. Yes. Supplements that you can take, and I prefer to use the word nutraceutical because there's a difference between just bland over-the-counter supplements that perhaps aren't very effective and nutraceuticals that are. For adrenal support, vitamins B5 and B6, you need it to be able to make adrenal hormones. Vitamin C, very important, and magnesium, other B vitamins. There's many herbs that can be taken to help with adrenal support. So if you're under chronic stress, there are many herbs that can help with that. The one thing to be careful about is Panax ginseng. So if you're already wired or have anxiety, be careful with Panax because it can make you more wired. But all the others are very good adaptogens that can help nourish the adrenal glands and help with stress. Bone support. It's not just about calcium. Now when it comes to bone support, I often get people coming in who are taking lots of bone supplements, but they still have osteoporosis. If you look at a healthy 25-year-old, 30-year-old who has the highest or peak bone mass, she's unlikely to be taking lots of supplements, sometimes doesn't eat a healthy diet, oftentimes doesn't exercise, but her bones are great. That's hormones. So when it comes to people with osteoporosis and they ask me for information, I like to remind them that all the calcium in the world doesn't rebuild bone. It may help prevent bone loss, or it may help build slightly if the other things are in place. But bone support isn't just about calcium. It's also about magnesium, vitamin D, vitamin K, vitamins B6, B12, and folic acid, boron, and the mineral vanadium. Let's talk about vitamin D. Active vitamin D is actually a hormone. You may know that by now. You may have been hearing that in the media, or your doctor may be talking to you about it, that active vitamin D is actually a hormone. There are vitamin D receptors in your brain, in your heart, in your skin, the ovaries and breasts, testicles, and prostate. Vitamin D regulates calcium and phosphorus in the blood, so it promotes bone formation and mineralization. But it's also necessary for healthy immune function activity. So it's anti-inflammatory. It also enhances white blood cell activity, phagocytosis. It may prevent autoimmune diseases, and it may prevent some forms of cancer. Extremely important hormone. Low levels of vitamin D are associated with bone loss, multiple sclerosis, Crohn's disease, and ulcerative colitis, so inflammatory bowel disease, depression, schizophrenia, rheumatoid arthritis, fibromyalgia, chronic pain, psoriasis, and cancers of the breast, prostate, and colon. When we're talking about vitamin D supplementation, I recommend cholecalciferol. That's D3, not D2. You want to measure your 25-hydroxy vitamin D. More is not better. So some people come into my office taking 10,000, 20,000 IUs of vitamin D without any monitoring. I've seen extremely high levels. They may increase your risk for calcification of soft tissue and kidney stones. So be careful if you're going to supplement. Really, get tested, right? That's why we have testing. And there's some research that shows that it can slow the effects of aging by 5 years. This was a study that was done in identical twins. I'm very partial to studies done in identical twins because I am an identical twin. And over 2,000 female twins, and the twin with the longer telomere level also had the higher vitamin D level. And these are the oldest living identical twins. They're 102 years old. They live, I believe, in Florida. Anne Primack and Charlotte Icegrew. She dyes her hair. She does. I read a story about her. She admitted it. This was the first vitamin D randomized placebo-controlled trial about cancer prevention and vitamin D. It was 1,100 IUs a day, which is a relatively small dose, in postmenopausal women in the Midwest. And at 4 years, the risk of any cancer in the vitamin D arm was 60% lower than the placebo arm. And when patients who had cancer within the first year of the study were excluded or taken out because the premise was that they already had cancer coming into the study, the reduction was 77% in the vitamin D treated group. Yeah, that's a lot. B vitamins, why do you need them? You need B1, you need B2, B3, B5, B6, B12, and folic acid for normal cell growth and division. You need it for normal brain and nervous system function. energy production, to make stress hormones, to prevent depression, and for a healthy heart. And I'll tell you, because it's part of our optimal aging assessment, every one of my patients gets their B12 level assessed. And about 25% are low. Very common to have a B12 deficiency. Antioxidants. Remember, antioxidants stop rusting. They stop internal oxidation or free radical damage. Very, very important. Very important to eat colorful produce full of antioxidants. Antioxidants that can be used as supplements include mixed tocopherols, ascorbic acid, which is vitamin C, beta-carotene and mixed carotenoids, selenium, coenzyme Q10, and lutein and lycopene. Coenzyme Q10 is a supplement that you'll hear about. And what is it? It's also known as ubiquinone. So those of you who have a biochemistry background or you remember your biochemistry, you'll remember that the electron transport chain that makes ATP uses ubiquinone as the rate-limiting enzyme. Ubiquinone is coenzyme Q10. So it's very important for your mitochondria to make energy molecules, or ATP. Your mitochondrial function slows as you age. The mitochondrial number decreases as you age. So keeping your mitochondria stoked with enough coenzyme Q10, very important. It's the most important for high energy demand tissues like your heart, your liver, and your brain. It's been found to be low in people with heart conditions such as heart disease, arrhythmias, cardiomyopathies, congestive heart failure, in patients with muscular dystrophy and Parkinson's, cancer, diabetes, kidney disease, HIV, and AIDS. And statins, cholesterol-lowering medications such as Lipitor, simvastatin, Zocor, etc., lower coenzyme Q10. They deplete coenzyme Q10. That data is pretty clear, up to 40%. So coenzyme Q10 is one of the supplements I recommend people take. There's a huge difference in quality. If you're going to take CoQ10, you want to take one that's been shown to elevate serum levels, otherwise you're wasting your money. Resveratrol. Have you heard resveratrol? Heard this term, resveratrol? You know it comes from red wine. It's a pretty powerful antioxidant. It increases nitric oxide, which means it dilates the arteries. It helps decrease